All right. Welcome to Coaching in Healthcare. I can see a variety of people coming into the webinar, and it's great to be here with everyone today. I love doing this webinar, and I'm excited about what the topic. We've also had a number of inquiries from people who couldn't make it, who were hoping that they'll be able to get the recording and so on, but there was a great deal of interest in this topic. So what I'd like to do is for those of you that don't know me, I'm going to just briefly introduce myself. We have a special guest panelist here today that I'll be introducing shortly. And obviously, every one of you most likely can read the screen. So I'm not going to go ad nauseum into all of this detail, but what I will say is I'm passionate about coaching and the value and the power that it brings to people. And I've seen this over 20 plus years of coming into coaching as a coach, with a number of clients all over the world, plus a coaching educator, which was absolutely not on my radar when I came into coaching. And so I'm hoping that what we bring here today will be of value. And having seen what it does when we bring coaching and people are using coaching skills in their leadership, in their work, in their personal lives, it truly makes a profound difference. And so what I'd also like to do, and I'm just going to move the screen across, and Kwesi, if you could show your video. I mean, what's it called? There you go. Great. I am delighted to have a fabulous guest panelist here today who's going to support what we're going to be talking about. And this is Kwesi Mobalakwa. And Kwesi is going to say a few things about himself. There was even more we could have put on the slide here, but suffice to say that Kwesi brings so much to coaching in healthcare and has a lot to share about his experiences, what he's learned, what he sees work, and so on. So I am going to also let Kwesi say a couple of things about himself. Go ahead, Kwesi.
Thank you very much, Allison, and very humbling. So pleasure to be here with you all this morning. A little background about myself. I'm an OD professional and consultant, most recently in the executive director role at a community college, and before that, the director for organization development and engagement in a health authority. We brought in coaching as part of our integrated talent management framework, but also to help effect change, culture change, and performance change. So it is within that context that I'm coming forward with you, and I think that's sufficient at this time, Allison?
That sounds great. And what I'm also going to do now is move the slide across, which will, as I can accomplish it. This is what our objectives are for today. As best as we can, we only have an hour, and we also recognize, and I'm also recognizing, we have a number of people who are in attendance who I'm sure may have some things to comment about in the chat area, et cetera, and we welcome that. You'll see in a moment. But what were the problems it was addressing? What has worked to support success? And it isn't a one-size-fits-all. There's a variety of approaches, and also the approaches that were used. We've got that. How results were measured in a particular case, which we'll be sharing, and what were the actual results achieved, plus some Q&A. And I think the Q&A, and I'd like to also at this point introduce Sandra Mall, and Sandra will be managing the question and the comments area, and I think she's already said something. Yes, use the chat or the Q&A to, and I'm just getting one so that I can see it. So somehow or other, and Sandra's also going to help with some of the, if there's some particular technical issue, as I see Josie's making a comment here, and hopefully that will be resolved shortly. So that's what we want to do. But first of all, I have a poll that whoops, I'm just going to, hang on. I'm going to put a poll up because I want to ask a couple of questions, and I'm just going to put it up, and it's so helpful to us to kind of know a bit about the people that are here. It's confidential, so just please understand that. But if you could answer the questions that are showing, and I'm assuming the poll is showing up on the screen right now. Great, I can see, yes, I can see people are now starting to be able to use it. Excellent. And I'll just give it a few moments so that we give you all time to answer the questions. And I know there's always nuances to questions, and you probably have questions about the questions. So please just answer as best you can, would be great. And I can see we're moving along right here. This is great. And then what will happen is once I give it about another 30 seconds or so, what will happen is I will hopefully be able to publish it, and so that we can all see, get a sense of who is on this webinar today. So we'll just give another little bit of time for everybody to have a chance. Is it that? I know I can see a few people are having a little bit of an issue. I'm so sorry. Sandra might be able to help. I'm not sure. So, okay. So what I'm going to do is I'm going to end the poll. And all right. And I'm going to share the results. So let's just see out of this. And I hope everybody can see this. Kwesi, can you see it?
I can.
Oh, good. Okay, then. Okay, so I think probably everybody else can see it as well. And so, okay, so we've got a large number of ICF certified coaches. Some are in training or taking additional training. Oh, we've got about 50% who are working in healthcare. We've got some other experts on the class of people who have brought coaching to healthcare, which is great. And is coaching considered, this was a great question Kwesi came up with when we were discussing this yesterday. Is coaching considered a foundational key leadership competency in your organization or organizations you work with? And I didn't differentiate it with healthcare, but what is nice to see is that 6 people answered that that there are organizations who are saying that, and this is indicative of the credibility of coaching, the value that more and more organizations are seeing about coaching. So that's great to see. So I'm going to stop sharing that, and I'm going to move our slide along. So just bear with me here for a second. So we were talking about what is it that is causing what are the pains in healthcare? And we have a number of them here, but I'm also curious. So some of those may resonate with some of you, some of those may not. And at the same time, I'm curious as to what we're missing. What other challenges are being faced that coaching, are you seeing, or that you believe coaching can address? And you can certainly note that in the chat area. And I know I've missed some things, as I always do, but it'll get the the mind thinking, hopefully. So I'm going to just keep an eye on the chat area and see what anyone else comes up with. But these were the things that we saw, and I'm gonna allow Kwesi to jump in here because he was front and center, right there in the trenches, so to speak, with one health region that was part of 7 health regions in the province of British Columbia that had brought in coaching and was bringing in coaching. And so I'm curious, Kwesi, what were some of the pain points, if you will, that you were seeing, or that why coaching was being brought into healthcare?
Right. Thank you, Allison. So when I joined the Health Authority, within a month of arriving there, we started our employee engagement initiative. There was also beginning a change in executive leadership and a recognition of a need to do a culture change. So you've got one, culture change wanting to occur. 2, there's employee engagement as part of that. And then 3, each time I start in any organization, I do my own environmental scan to find out what are the issues that are getting in the way of people being able to do their jobs. So what do we need to do more of? What do we need to do less of? What do we need to stop doing or start doing? And a lot of this, the current challenges that people have put forward were, present with what we were doing. So in the course of my work, I was also communicating with my confreres in the other health authorities, 3 other ones, and we're coming across the same sort of challenges and issues. Within healthcare, there is not an abundance of resources for some of the work that we're doing, but the demands don't recede at all. So I had conversations casually, said, why can't we work together, collaborate? Let's start talking about what are the shared issues we got. It's the same collective agreements, same conditions of employment. Why don't we work together? And a couple of us were doing it. We said, why don't we expand this to a couple more that we were each individually working with? So we gathered together in one location, and 4 of us started what then became a provincial initiative. And it was all about how do we start harnessing the collective resources we have to share them, so that we give people within healthcare an opportunity, not only within our own organizations, but within the province, to move around and also be trained in a similar way, so that the transitioning from one place to another would not be with training and development that was unknown to others. It would be a common base, common language that we could have begin to permeate across the province. And that also tried to tap into some of the work that was going on nationally around that with Leeds. So did that answer your question?
Yes, and if you had to, yes, that's great. And if you had to come up with the top 3 reasons why coaching was chosen as part of what all of you were collaborating around, what were they? What would you think?
Okay, so coming up to with the leadership development program, okay, there were 5 elements to it. There was one which was, we recognized there's a need for coaching, and coaching is a great tool for helping effect change, whether it is on an individual basis, a group basis, organizationally. And the way I look at coaching, and I say to people, it's a way of being. It's not a thing you do and then do a checkbox and walk away. It's actually can affect the way you approach. Therefore, it affects the way you perceive it, affects the way you are now entering into a relationship with other people and creating the relationships you have and your team have with other teams and other people. So coaching really, if you embody it, you really come from a place of curiosity. You're making a presumption that the people you're working with are coming to work with positive intent, that they're coming in to try to make a positive impact in roles in the same tradition that you are. And the question then begs itself, if something happens, why don't we get curious and start finding out what got in the way, as opposed to going to a place of judgment saying, oh, there they go again doing this, that, or the other, which then puts up those barriers, which then automatically means you're starting from a place of trying to break down some walls that have been created and not necessarily knowing why they've been created, because we haven't asked as to what happened. We've gone to a place of judgment.
Yes. Okay. And I'm also noticing some of the comments in the chat. Judy, for example, change happening at breakneck speed. I mean, it's just wild out there in terms of what's happening there. And you said, you talked about that. It was you know, affecting change is what was a singular critical pivotal point. And then another comment from Cheryl is saying healthcare is one of the unhealthiest work environments. Long days, feeling of being overwhelmed by the demand on the resources, not able to help in a helping scenario. Right. Oh, that's great. And go ahead, Kwesi.
You know, and you know, the points that people are raising are very valid. And now part of the reality I brought out, you know, in the organization, and again with the college where I ended up with most recently, I said to staff, look, we're not helpless participants in this journey. We're active participants in this journey. So it's incumbent upon us also to say, hey, I'm drowning here. And there's not enough. So I had to go to my boss at some point when they were saying we need more. And I said, hold it. Here's my work plan. I've got all these items. Which of these things are no longer a priority? To which do we no longer mean yes? Because I've only got X number of hours in a day. We're already doing A, B, C, D, E. I can't give you more. So which you help me, what are the priorities here? What comes off, what stays on? So I put that back on my executive, and then we went back to the executive saying, okay, this is what we've got. What's actually doable? Let's be realistic instead of burning people out, you know? Okay.
Yes, and that certainly is been my experience when I've been speaking at organizations, healthcare, colleges, you know, for-profit places, I mean, on and on and on. And I remember I was at one recently where we had about 300 people in the audience, and I said to them, and they were all working for one large organization, and I said to them, how many of you in the last few days have had something new that you're dealing with that you've never dealt with before, never had to figure out? And I, you know, asked them to raise their hands. And of course, all of you can relate to this as well, is I would say 80% of them or more raise their hands. I mean, it's quite something that's going on. And I just wondered also, the other thing that was motivating some other healthcare areas as well was the low engagement scores. And I'm wondering, Kwesi, if that was possibly part of the reason as well that coaching was being used?
No question. We had started, and then there was a provincial initiative for a number of years where there was a provincial employee engagement scores, and our scores, both individually as organizations, but also collectively as a group, were in the lower quadrants, right? When you compared them with other industries across the country. And so the question was, you know, how do we begin to create an environment where people want more engaged? Two, they feel included in the things that affect them. And three, they start coming from a place where they get curious and supportive of each other. And so coaching really plays a role in giving people the skills on how to, one, start thinking, start speaking, and then behaving perhaps differently and showing up in a way that is different than what they would have had otherwise. The response when we did the coaching, it was typically the first day, the second day of our coaching workshops, because we ran them over 2 days. And at the end of the first day, gave people an assignment. And that was, take what you've got today, okay? Just take these 2 skills and go and ask the question to someone at home. Just try it out, just ask and just listen, and then come and tell me what happened. And the feedback the next day and this is invariable to all the workshops I've done, invariable. People came back going, whoa, you know, what a difference. Like, wow, what a difference. And, you know, a couple that really resonated was a mother who'd been constantly battling with a teenage daughter and came back and said, oh my God, I can't believe it, but it was the first night in a couple of years where we weren't shouting at each other. It was, you have no idea what that felt like. And that showed the power it can have, not only at work, but also in our personal relationships, because we take who we are with us wherever we go, right?
That's right. That's right. And I'm also just being aware. Wayne, hi. Nice to be reminded of you as well. I'm working in an Ontario hospital coaching with the VP of Patient Services and one of her direct reports, manager maintenance. Ah, okay. And unions. Yes.
What's the challenge with the unions? I mean, I'm curious.
Yes, Wayne, what can you say a little bit about that? And as he's doing that, I'm going to just move our screen across, or our slide across, because it actually it resonated with me at this point too, when you were talking about after day one, when you were delivering coaching skills training and in your workshops. And this was a comment that I've had from some people in healthcare, said in various ways, but they're just hungering for different types of conversations. And coaching is a different type of conversation. And okay, so now I'm just seeing another comment from Wayne. An employee is using safety and union grievances to not do his work.
Right. So, and in that situation, and I get that, we would typically deal with staff and say, look, there's a performance managing issue, okay? And you can take there are times when you need to take a coach-like approach, and then there are times you need to be directive. But coaching doesn't supplant the other managerial responsibilities a manager has. It is simply another tool. So the place to come, I think, with the unionized person is to find out, and again, for them, this may be an issue about change. What are the resistance points? What's the pinch points this person is having? Because my way of putting the coaching is, this is allowing us to get curious about what's happening for you in the workplace. Right? So how I would be stepping into a conversation with that person from a coaching point of view to try to understand what's the resistance, what are their pinch points, and then use that to help inform how I choose to go forward with them.
Right, and I appreciate, yeah, Wayne, you bringing this up, and of course, it's a so it's not creating the success that you would like or they would like, and so it sounds like there's other approaches. It's part of the toolkit. But and I'm sure we could, spend a lot of time just focusing on that. I will say though, in our experience, we have had union and non-union environments, all which I couldn't believe actually, in one room during one delivery of our coaching skills program, and it worked. They were talking with each other, and it was because, or what we were experiencing was the curiosity, the listening, the wonderful skills in coaching. It's not about telling and that kind of thing. And I think that it just created the right environment at that time. So, but I won't say any more about that. There's a lot more to say. Kwesi, go ahead.
Just a quick point on that one. When,
yes.
If you want to connect with me after this conversation, I actually have a tool, and it's in the shape of a clock that walks a person through the process
great.
by which we get to, you've got a final choice and there's an ultimate decision that gets to be made. So I'd be happy to share that with you and walk you through it if you want. Okay?
Great. And I'll be sharing our the contact info at the end of the webinar. So, okay, excellent. Thank you. Oh, great. Okay. So, all right. So what supported the success? What supports the success in organizations, and what supported the success in healthcare?
Okay.
to do this, and I've got 3 things up here, and go ahead, Kwesi.
Okay, so one internally within the organization, I had executive support from my VP as to what it was, and that was predicated on me coming up with a clear plan of what an integrated talent management framework looked like, what its elements were, and then connecting that to the strategic objectives in the organization, and then for departments, how this work would translate to helping them fulfill their support of those strategic objectives. Within the what do you call it? The collaborative, the provincial collaborative, and I've been trained in several different coaching techniques or sources, and this was the one that I was partial to. There was others I was trained in, because it was for the ease of use. And so we had to have a conversation amongst the health authorities to which one we're going to. And so part of our structure as a collaborative, we had working groups, had a working group for the coaching that would lead and help direct how coaching would roll out, mentoring, and leadership development from frontline, mid-level, and senior leaders. So on a provincial level, we had representatives of each of the separate health authorities sit together and talk about how is it we're going to be, how we're going to roll it out, what would be the standards, what would be the credentials for the people being trained, etc. Recognizing there's a provincial lens, but also allowing for the individual realities of the respective organizations. So yes, there's a standard to which we're abiding by, but recognizing the differences in each of the organizations, giving some latitude for some flexibility to make this work in a way that made sense for them.
Mm-hmm. And I'm also noticing Rick saying the 3 key elements are a triad, and you need all 3, especially 2. Good slide. Thanks, Rick. And you're right. That's right. In healthcare, you need all 3. It can't be all external. It's too costly.
Exactly.
It can be a mix, but it has to have all 3. And I can see someone has raised their hand, and I'm just going to see, I just moved us over on my screen. So I'm trying to figure out who raised their hand. I don't know if, oh, Izzy. So Izzy, a quick question. Do you have a mic? Are you able to speak? I'm going to promote you up to ask your question and see if that can work. So just bear with me here for a second, and I'm just going to go there. So unmute. Okay, so Izzy.
Hi,
Hello.
I'm so sorry. I didn't mean to raise my hand. My apologies. It was a mistake.
No, oh dear, I put you in a spot. Well, it's lovely to see you. And do you have a question? And I'll free you up in a sec.
No, I don't. I'm so sorry. I was switching from my phone from my computer.
No, that's okay. Izzy, great to see you. All right, I'll take you off the hot seat there. And if I'm not sure, but theoretically, Sandra can move you back to, yeah, I've got it. I figured it out. Good. Okay. You never know what can happen on these webinars. Okay, so yeah, so these were 3 key elements. We're covering a lot, but I think that's so important, and Kwesi's comments as well. So what I have another one, and it is different ways that it's been rolled out that we've experienced through the work we've done and the work we've seen done. And just a second here, I want to just move something here. We're talking about Organization A, which was 700 leaders, managers, directors over 4 years. But they had to ensure the buy-in. And maybe with the stakeholders and determine what will be measured. Right, Kwesi?
Yeah, we did a similar thing here, Allison, in that we have a 2-day workshop, and then that workshop is followed up by triads. So people get broken down into dyads or triads, and they practice. They meet once a week for an hour and a half. So they can sit in the role of the coach, the coachee, or the observer. So they develop their skills from all those dimensions. And so you're embedding the learning from the workshop into it, and you're allowing people to bring the stuff they're dealing with on a day-to-day basis into those sessions to get help and workshops. So what they ended up building was this little network of people within the organization they could turn to, who'd been through coaching with them, and just bounce those ideas and have someone walk them through that process. So I see someone ask the question, what do you do with a small organization? And it's the same thing, is it's too expensive to use external consultants all the time. So you need to build that internal capacity. But those people don't need to be HR people. They don't need just to be OD people. There are people who've been doing this kind of work, that they're curious about facilitation skills, their coaching skills, the change management. So they've got some skill sets that are adaptable. So I created, in each place, created this stable of people who had coaching them become part of their job description. So we would pay for them to get coached through coaching out of the box. They become licensed trainer, and then part of their work plan, they became this coaching, this facilitation. This became part of their job. That was non-negotiable. So that was a huge, I think, win in terms of people recognizing this is something that is going to be embedded as part of who we are and the way in which we go about conducting our business. So no matter the size of the organization, you can scale up so long as you've got people in the organization and there's a flexibility to people who want those professional development opportunities, because as we know with millennials, they're going to have numerous different career paths. So you're setting them up to be able to do different things and scaling them up to provide them in different ways. Right.
Thank you. And depending on the size, I mean, some organizations are very, very small, and an external would be absolutely ideal to come in, deliver it to the organization. And hi, Kristen, thank you for your question, by the way. And then support those people in, you know, that person, the external person, could also support the triad work, could also support developing their skills, and could come in at different points and continue to refresh, continue to strengthen their skills, troubleshoot when it's not working, and so on. If it's a real small organization, it may not make sense. But the more you can develop that coaching capacity amongst the staff or the people, the better, because they're all, of course, modeling it. And
if I may just briefly interrupt, because it's a little funny piece. Remember when we did us up in the health authority, we brought you and Pam Richard, right?
That's right.
Learning. So we had to bring in that external expertise so that we could be refreshed, but also evaluated and given tips on how we could improve our own internal abilities. So I think that's a critical piece, is to continuously want to improve and use those internal and external resources accordingly.
Right. Thanks, Kwesi. It has to be a commitment. It has to be a commitment by the organization, by the people, by the stakeholders, et cetera, that this is not, and I know, I can guarantee there's many of us here attending this webinar who have experienced where something's been brought in 2 days and, oh yeah, this is all going to happen, and then nothing. No support, no communications about it, no modeling it, no nothing, right? Has anybody, I mean, aside from me, and I'm guessing many people have also experienced that. So it's not a quick fix. 1 day, 2 day, it's got to be an ongoing process to make sure that that happens, and sharing, having a communications plan to share what is happening. Didn't you do that, Kwesi? You were communicating to people in your particular region what was going on. I think you were. I mean, it wasn't just getting together. There was some.
No. Coaching, we put coaching into the context of this is one of a number of things that we are doing to get to where we need to go. And I think one of the challenges that managers have is connecting the dots of the various things that are going on, for one, themselves, but also for the people that report to them, so they can see how things are, one, interconnected, and two, how they support the work they're doing to get the organization where it needs to go. So there is a piece about seeing a holistic or systems lens and putting the pieces together so people understand why the dickens are we doing this, to what end, and also how will we know we've arrived? We'll know we've arrived by when. How will we know? So what are those behaviors we can expect to see? What are some of the outcomes we can expect to see? And communicate that along the way.
Yes, yes, exactly. And so I'm just wondering, could you say a little bit more about, you were talking about a systems approach. Could you just say a little bit more about that?
Yeah, I think one of the challenges from my personal experience working is we typically tend to see things from the lens from which we stand. We don't see it from upstream or downstream, that if I'm going to bring in a change, it's going to have an impact on other people. Okay, so when I have that idea, the first thing I might want to do is say, okay, I got this idea. Who's going to be affected? I'll go to them and say, hey, I need to have a conversation with you. I've got an idea. This is what I'm thinking, and this is the problem that it's going to address. Here's the need that is going to be fulfilled. What's the impact it's going to have on you? What do I need to consider so that it doesn't adversely impact you? So bring them in from the very get-go when you're trying to have this conversation. Same with the people who will be affected, so that there's more heads than one come into play when you're trying to deal with an issue. Again, and this becomes like you now start learning how to coach, but also emotionally intelligent to have those conversations with people, you know, so that you don't raise hackles, but you're mitigating them. And coaching actually helps you learn how to do that stuff. And if you're coaching coming from a place of curiosity, it's, well, who's going to be affected by what I'm doing? So now I start looking beyond myself. Well, how am I going to get their support? Again, that's a coaching question. Now I start behaving in a different way. Now I'm bringing people in. It's no longer about my idea, it's our idea. And once people create something together, they have a vested interest in seeing it be successful, as opposed to something that someone is just basically saying thou shalt do and saying, yeah, that's nice, have a good day.
Right. Okay. Thank you. And the other thing that we've seen, and I've seen this in a number of organizations, is that you'll see the learnings here, and we've touched on some of them. And but there's two key things I want to emphasize here, is using real life examples. In other words, modeling coaching, but not pretend. Not make up a story, not role play, but real. That is where you get so much credibility, whether it's you that's delivering it and you're willing to take that risk and demonstrate in front of participants, etc. That is so 1,000% critical. And then the other thing is that it's connected to other programs. And we've seen this happen where it's literally embedded in leadership development programs. We certainly have experienced that quite significantly. And I'm seeing it in any leadership development program. Some are creating their own in modules, etc., and they may add in ours or create their own model proven that they'll use as part of the leadership development that they're doing in the organization. But it's so important to continue on with this. And I want to say something else, and I want Kwesi you to speak to this as well. It looked like you were going to say something. Did I stop you?
The point you made, Alison, is absolutely relevant, and that is in the workshops, it's an experiential reality for people that you bring in real life issues, and we actually coach them through it. So, and I'll say to someone, give me anything, you know, spur of the moment, whatever it is, bring it up, and I'll coach them through it. And so when we break down, it is no made up stuff, it is real, and it can be, okay, so that's relevant for them. It can be from any realm within their own life. Mm-hmm. Right? So it needs to be real for them, because if they've got a challenge with how do I deal with pre-daycare support, and so I'm coming to work late, which is now having all this ripple effect in the organization, help them with that issue. That's a valuable coaching question because it's got a direct impact in the workplace. Help them. Right? So it's very relevant. Bring in real things that are, you know, make sense and pertinent to people's lives.
Right, right. Good, and that's certainly what we've seen, and I'm curious too. Feel free to jump in with your questions or your comments as well as to what your. Oh, good, Judy. In our hospital, linking to other programs, i.e., we have adopted LEADS. With LEADS is, as you're saying, is an excellent launch pad for building on the skills of coaching. Yeah, it's not all by itself somewhere else. And the thing that I think is also important, and I think it can get, people can get concerned about this, is what we've got up on the screen right now, which is coach approach, coach like, and miss. And excuse me, it doesn't have to be these formal coaching situations where you're sitting down for an hour to talk with somebody or a half hour. This is not realistic. In busy healthcare, I mean, it can happen and it does happen, but in busy healthcare organizations, it's about using an approach, or another term that a number of people use is to be more coach-like in their conversations. And it does not mean that everybody has got to become a certified coach. It's not realistic. Some are not interested, but how can we, any of us, and the work in healthcare, support having more of those coach-like conversations? And I'm just curious, Kwesi, from your perspective, what did you notice? What did you see?
One of the things that we do, we typically had, and I'm not sure if I'm answering the question here.
Go ahead.
Is we would have alumni sessions for people who had already gone through it so that they could refresh. But two, we very much encourage people to go talk to others who had been in programs so that they become a casual reference and support for each other. Now, in the workshops, one of the things people say, oh, I can't do this in 5 minutes or 10 minutes, it's unrealistic and all that. And I say, okay, fine, give me something. And we'd walk through it in the triads and go, how did you do that? I says, I just listened to the answer you give me. The next question is embedded in your response, if I'm actively listening. So people don't need to become certified coaches to be coach-like. Two, you need to give people tools that when they walk out of the workshop, they can actually use. Okay, and that was one of the criteria I had for my team with anything we brought into the organization is, how is this actually helping someone when they walk out the door, they can use this with a challenge they've got in the workplace. And if it isn't, we have failed. There is no other marker that I'm going to use. And so when you bring in coaching, you help to explain people, it's not only about we'll walk you through the process and you know what's the pieces you need to touch upon, it's really about your presence, how you show up, and the state of mind with which you approach the issues that you face.
Exactly. And I remember one region I was working in, and they did what they called coaching cafes. And I was at one of them. And there was about, I'm doing this from memory, but there was probably about 50 to 70 people there. And they were all at round tables. And my job was to demo, to be real coach-like conversations, but we called it the model that we have is the 5-5-5 model, right? And anyway, we called it the 5-5-5 in 5. And I was sitting on a stool. So, and by the way, for all of you who are coaching and into coaching, I'm telling you, it will grow your skills profoundly when you're put on the hot seat. And people would come up and sit on the other stool, and literally we were timing it because we wanted them to see, as you know, Kwesi was sort of addressing as well, that it is possible. It is possible to use that and have that approach in a very, very short space of time and have it be of value. So I want to, and I mean, there's so much we can say about that, and we're touching on a number of things here in this webinar, but what I also want to go to, because this is where the rubber meets the road and where it's so important that you measure that you measure the results and you set yourselves up, because in any large any organization for that matter, you know, when times get tough, issues get in the way, crises happen, and so on, what do they're just dealing with that. And if it isn't valued, if there isn't quantifiable evidence that this is doing something, that's where you're going to have problems. So it's very important that you design that when you're bringing in coaching to any organization, to your organization. How are we going to know, as Kwesi was speaking to earlier, what's going to tell us this is working? And I get it. I've talked to so many people in healthcare who go, well, yeah, we just don't have the time. So you got to make it relatively easy. And as you can see on the slide, they created an evaluation framework. I don't know if you were part of that, Kwesi, but you probably were up in yeah. Is there anything go ahead.
There were things that each of the separate organizations did to evaluate the impact of coaching in their workplace, and each had their own approaches. And then we had, you know, the responses from a collective, provincial, collaborative point of view. Internally, where we were, one of the things that we had noticed, we had issues, one with our engagement scores, and our engagement scores over numerous years, consecutive surveys, went up, okay? Secondly, our grievances went down. Okay, the number of grievances we had went down. The respect in the workplace complaints went down. And so one of the things is, I want to be very clear about this, because we live in a real life experience, we can't hold constant one variable to say, if we do this change, it's just dependent upon this one variable. So what I couch my response is, when we did the following, ABC, coaching, leadership development, but also started other things about our within the leadership construct, these are the changes we started noticing within the organization. What came out from people, one with exit interviews or two with the engagement scores, is the qualitative data people and the anecdotal information they were giving us. And there was enough of them. So when you're getting 40, 50 people, 60, telling you very similar thematic response, then you're beginning to say, okay, so we are beginning to see this is taking traction. This is some of the impact. And this keeps getting brought up over and over and over again.
Yeah, so the more that you can make sure that you're doing that, it's extremely critical. And I want to just share, and this was with the health authority in BC. These were qualitative results, and myself and a couple other people presented those to Harvard Medical School Institute of Coaching in McLean Hospital a little while back. And these were the 7. There were other results achieved, but these were, and I'm thinking, what organization would not want this, right? And by the way, there's much more detailed with percentages and so on, but for the purposes of what we're sharing here, it makes sense to provide this. But ability to give feedback, I hear this over and over and over again, this challenge around, how do I give feedback? How do I do it? The coaching has really supported that. Communication, obviously. Listening, massive, absolutely massive. Conflict resolution, as you were talking about, I mean, you mentioned grievances. I mean, kind of the same thing in a sense. And I'm thinking of Wayne's comment earlier about in the union environment, positively impacted relationships. The team, I mean, this was, I just thought this was great, team dynamics and team communication. And this one is gold. Absolute gold is just using the coach approach and learning it. They have that increased ability to engage in conversations that are solutions focused and promote accountability. That's where the rubber really meets the road and where things can happen farther, faster, easier, quicker than they would have if you hadn't had that what I call that structure of accountability that using being coach-like and using a coach approach provides. Anything you want to add to that, Kwesi? Anything you want to say about that?
Yeah, when you were sharing, I mean, there was two pieces that jumped out. One, to be clear, when you undertake a coaching conversation, you're not necessarily going to resolve their problem fully within 5 minutes. You're going to move the person forward with their next constructive step to finding a resolution, okay? That's, we need to be clear on that one. The other piece, though, is you just gave a great example, coaching used in context with other tools. So, for example, something like an MBTI within the context of a team dynamic, I got feedback from a health administrator saying, what she had noticed in her organization, where before there would be this boom, boom, boom clashing. Someone said, oh, they're coming from this point of view. So I guess they interpret that. That's what they would. So now I need to ask them this. So that person's mind frame, instead of one going to a place of judgment, was using the tools that she had, coaching and other assessments in tandem, to find a way forward for working with another group that otherwise had been historically a challenge for them. That's the beauty of coaching. It complements and supports other things that we're trying to teach and develop within our managers and leaders.
Absolutely. Yeah. Thank you. That's great. And here's the other thing that was so interesting, and beware. If you're going to bring in coaching to an organization, whether you're internal or external, and maybe Judy's had this experience, I'm not sure because I'm seeing different comments. This is what happened that was completely unexpected, because it was originally leaders and managers, directors, that kind of thing. And what has happened is a buzz was created. And more people within the healthcare system. And remember, if you can bring coaching to healthcare, you can bring it anywhere, because there are so many multiple stakeholder groups. And this is what happened, is that it just spread and moved into areas that no one in their wildest dreams could have imagined. Have I got that right?
Oh, absolutely. I mean, we're in our organization, where when it was actually, it became part of the leadership development program. Right? So every year, annually, the docs looked forward to it. And so, yeah, there's no one who cannot benefit from utilizing how to be coach-like.
And it when you see this, and here's another one that, so you see this, and then the other thing that happened was the way it was done. So it was an easily, you'll see this screen up, where there was about 350 people over the course of 6 years, but boom, when the sweet spot was hit with an easily adopted program, the internal support, the key stakeholders, etc. Look what happened. And this was just in 4 years. It went from that all the way up to over 4,000 people. And it's gone way beyond that since. But, you know, remember we talked about the three components. I think we mentioned that. There was a screen up a while ago. That's the triad that we were talking about in terms of what is it that you need to have to make this work. I mean, this is certainly a success story. And anything else to add to that, Kwesi? I'm just curious.
I can only encourage people to investigate if they've not already undertaken. And I would encourage people to reach out to others outside your organization for ideas. People are very helpful, and people are very creative. So tap into it. If people want to help. I just see nothing but positive things coming out of it. There is one caveat, though. When an organization opens itself up to including things such as coaching, that means people are being given permission to ask. Now, asking sometimes will, for some people, look like a challenge, and it isn't. But what it is, people need to understand is, we've got a reality in our workplace where the majority of people are now going to be millennials. They have been included from when they were little, you know, gaffers to the ground, in the things that impacted them. There is an expectation with that work demographic that they will be included in the things that affect them. learning to hear what they've got to say. Coaching can help you find a way to connect with them, bring them in, and give them a sense of purpose and meaning for the things that impact them. And hopefully they won't be mercenaries working in your organization, but people who are willing to commit a little more time and effort to you. So to me, this is a tool that should be used for the reality we've got coming ahead of us.
Mm-hmm. And yes. Oh, yeah. And I've had that conversation fairly frequently now. I know one where, you know, the boomers and some of the other ones are leaving, and this old way of doing things is just not cutting it. And so coaching, of course, is there to is a fabulous tool. And I'm just curious, I'm noticing Judy's made a comment. Thanks, Judy. Happy to talk to anyone in healthcare or other. I'm an internal ICF coach in a hospital setting. Would love to spread the good word about our experience and had the joy of having, oh, Allison, teach me it. Well, Judy, thank you. I've got the, yes, I set that all up. That's very sweet of you. And thank you for that. I really appreciate that. The other, okay, so what I'm curious, because we've got just a few minutes, and so questions. What's coming up? And what is one thing, you can even put it in the chat, that you're getting as a result of this webinar today? What are you walking away with? Please just put something in the chat area. Plus, if you have a question or a comment you'd like to make, is really, really helpful. And as I'm looking for that, I'm also going to move, well, I have the questions screen up, but I'm also going to just do my little promo. Please reach out to me. Here's the information to reach out to me. You want to talk about this in more detail, but also Kwesi has offered, because he's done this, and his information is here. We will be setting up. We will be sending this information out afterwards. Somebody's saying how to measure the impact of coaching. Okay, great. That's, yeah. This is so, obviously I've said that before, it's so critical. And I'm also, yes, oh, the clock tool that Kwesi spoke about. Okay, and the evaluation results, you're seeing that here on the slide too. You really inspired me more than ever to continue to bring coaching into dental practices. Yes, Kristen. Oh my gosh, what a thing to do there, no matter what size. And defining deliverables. Wishing Nova Scotia could borrow Kwesi to help with healthcare transition. Okay, all right. So yes, there, and he's available. I don't know about going to Nova Scotia necessarily, but with the technology we have now, it's you know, it's easy, so much easier to do that. So there's Kwesi's contact information, and again, meet with us to discuss your needs. Check out our calendar of events. Join our LinkedIn group. We've kind of been quietly working away. We need to do more, but it's there to keep the conversation going. And I just want to take one moment. I see we've got about a minute left, and I just really want to acknowledge Kwesi for being willing to come and share his wisdom today in the real world. In other words, what really happens. This is not pretend, this is not made up, this is real. And what you experienced as a result of adding coaching in to the organization. And I am just so appreciative of the time you took to share your wisdom and what you learned, and the challenges as well. So thank you very, very much. And I also really appreciate Sandra's support today as well. And what if everyone in healthcare had coaching skills? That's what I want to leave everybody with. That's what we're passionate about, and dental practices too, Judy, and Kristen. So thanks everybody, and have a great rest of your day and rest of the week, and we'll keep you posted about any other upcoming webinars. So bye everybody. Thanks so much again, Kwesi. Really appreciate it.
It's been a pleasure. Thank you very much.
Okay. I'll just stop the recording.